So here is some why you can see some variance in other styles of testing. So for example, that live cell that we tried here that Dr. Burdette saw two totally different things when he ran it on himself, his real name and then one fake name, they're very hard to reproduce. The things that make a white blood cell grow can vary, like if it, moisture in the air, and there are other ways that are not controlled for. So for example, what this test looks at is when you put a piece of food next to a white blood cell, how much does it grow? And growth can happen for positive reasons as well as negative reasons. You can also force this reaction. If the white blood cell, and so they're not even looking at all the same white blood cells, they're looking at different types of white blood cells, but if that white blood cell takes in more food, it will swell more. So there's no control for how much food is being taken in compared to how much swelling goes on. There are ways of doing that, and that's done in commercial laboratories, in academia when they use this methodology. They use a radio-labeled methionine isotope to tag to say if the cell uptook this much methionine, then we can build a ratio that it uptook this much food, and you use that to control to make sure it's not just the amount of food that drove the reaction, but really to be able to quantify that. They don't do that in commercial labs, and so this is another reason you can get a lot of false positives. And again, if you've seen these tests, people come back reacting to everything there. When I was at IFM this past weekend, they were sharing even some of their own research. And so by their own admission, by research that they put out on 6 samples, it talked about in a severe reaction, the cytokines were made 36 to 42% of the time. And that was, to them, a favorable piece of research. So I would have not put that out if it were my piece of research about my own lab, because I interpret that to mean, 64 to 78%, I'm sorry, 68, my math is bad, whatever, 58 to 64% of the time, still off, whatever, you know what I'm trying to say, when there's a severe reaction, cytokines aren't produced. So again, you can swell for a positive or negative reason. Now, to determine if that swelling was positive or negative, what is the cytokine profile produced? Is it the inflammatory cytokines, IL-6, IL-8, TNF-alpha, or is it that it was just a healthy cell making more hydrogen peroxide, so when the opportunity for phagocytosis comes along, it's really ready? You don't know unless you measure that next step why the swelling is occurring. And so the swelling, the cytokines in their severe reactions are only produced 36 to 42% of the time. Even with bad math, I can tell you that's less than half the time. So to me, I don't know. I interpret that as not something that I would be happy about, but to each their own. I'm happy with the 97% of confidence variance and reproducibility. And then you have the other side of the world where people only measure one type of IgG. That was the style of testing that we used previous to the ALCAT, and you'd see them come back like maybe dairy, maybe sometimes, and it really just tended to miss people. So some other pieces, when someone says, but this test said I wasn't allergic to that, some other things to watch out for are, first of all, not all labs or other tests are using organic sources of the food. We use organic sources of foods on our plate because if we didn't, is your reaction to the pesticide that was on that food, or is your reaction to the actual food itself? And so maybe you see a pattern on another test where they came back highly reactive to, help me out here, Frank, to strawberries, and what else is laden with pesticides? What are our big top pesticides?
Tomatoes, all toxin things.
Spinach.
Sprouts, maybe, spinach, strawberries. Maybe you see like the heavy pesticide contaminated foods all come back, and you would have a rationale for saying, well, they're probably not using an organic food source because it costs more. That's why people don't do that. And so another methodology piece, or this isn't really a methodology piece, but this test said I'm gluten sensitive, this one said I'm not, is that grains themselves have very independent storage mechanisms. So one type of wheat might store things one way, where another type stores things another way, and this creates different amino acid sequences it's not per se that either test was wrong, but they were using different wheats, which means that you could have different reactions because of that. That's also why gliadin is on there as well. It helps to control for that because that's a very purified gliadin that is on our test, and so it means that it helps us to capture if they're sensitive to gluten or just other amino acid structures in the protein, or protein, other amino acid structures in the wheat, and it also helps us to see then, to make sure that we're not missing that gliadin piece just because of different storage mechanisms for grains. That's also why you want a food sensitivity test that has a lot of different grains on there too. Helps you give a picture of if any of that's going on. This is another one that is quite helpful. So in a standard food sensitivity test, so you got 96 wells on a plate. Bloop, bloop, bloop. And so and if we're trying to save money, you just run your paintbrush across it with the different foods. You coat all at the same level. Well, that's okay, but in vitro will never be exactly as we are in vivo. It just, until the lab is able to replicate God, which I don't see that in the very near future, then we are going to have to know that in vitro just isn't perfect. So sometimes because of certain foods and reagents, we might see a higher binding affinity. And so what you could see is, for example, a test that came back with a whole bunch of peaches and cranberry all the time and not much dairy or gluten. And we would say that that's not a good test because it doesn't represent what's in the population. What we should see is a test that comes back higher in wheat and dairy and less so in things like peaches or kidney beans or things that we just know a large percent of the population doesn't react to. And so as he was developing this test, when he got back 20,000, 30,000 specimens, he looked at these distributions and they looked like what should be happening in the population. However, where there was some variability where maybe it was too high, then he did some things like on those particular antigens, you can coat at a different level, because not only can I just slather on my brush at one level, I could super hyper paint a well, and if you put enough stuff in there, just like the problem with the growing white blood cell, you can force the reaction eventually. And so again, we're looking at the monoclonal versus polyclonal antibodies, and we're also monitoring from batch to batch. I can't say because I'm not inside other labs what the practice is. So, but just like when you make a supplement, when you make a batch of plates, you better be testing those to make sure that nothing was off, that there wasn't some weirdo thing going on. Also, we are moving to using more of a robot arm. So we were using people to fill those different wells, but now we'll be using a robot arm that fills every well at the same time. That's going to give it a higher level of sensitivity too. However, we're not removing the people because again, in vitro is never the same as in vivo, and a robot's not going to catch it if it looks weird, and there just is that element to it. No lab is perfect, and so when you get things completely automated and people aren't looking at them, then you can have batches of things go array. So we're not doing that either. We're using a hybridization in terms of standardizing with the robot arm, but also having people to overlook and say, whoa, everything shouldn't be lighting up like this. Something's wrong here. I'm not going to report that result. So just some more attention to detail, I think. So these are our types of IgG immunoglobulins out there, and just kind of a review of what they're doing. Remember that 60 to 70% of what you're producing is an IgG subtype 1. So again, it kind of begs the question of why would somebody choose to just measure an IgG subtype 4? And I never got a real strong answer to that. So you could miss 60 to 70% of the reactions going on amongst immunoglobulins if you're only measuring one type. And they also respond to different things as well. They respond to generally protein areas, but people will say, but what about this food? It has no protein. You should never have a reaction to it. Not the case, because other immunoglobulins also respond to polysaccharides as well. Now remember, the physiologic role, or maybe not exclusively, but at least in part, of IgG subtype 4 is actually to blunt IgE, your anaphylactic reactions. So when I am giving a sublingual immunotherapy or an injection therapy, the point of that is to upregulate IgG subtype 4. It will bind to IgE and reduce the amount of anaphylactic shock in the body. So again, another reason that it's a weird choice. We probably know this from clinical experience, but I wanted to share Dr. Dorval's experience too, and he's looked at these things. A significant decrease in your titers around 6 weeks. So if you had some mom who was really freaking out about what their kid could eat or not, and they really needed to know by 6 weeks, then you could get some meaningful clinical information around that time in terms of seeing titers come down. But remember, like we talked about yesterday, in some people titers will stay high more long term, just like in a vaccine, and in some people they're able to clear these things more quickly. An average half-life is 21 days, but remember, we're back to that CR1 receptor status on the red blood cell. How quickly are you able to shut off these reactions? A point on that previous slide that I just want to at least say it twice. I know I said it yesterday, but I think it's a good point. When people say IgG bad, sure, but we are also adding to that to add to the part that it might miss. So these can precipitate out into tissue like kidneys and endothelium. This is an inflammatory reaction. So by adding the complement, which we're the only lab that does that, then you're really increasing the sensitivity and increasing the capturing of symptoms. So again, I touched on this a little bit yesterday, but I think it also bears repeating that we get back some of these tests and we say, the test is bad, you don't show any reactions, I know that you should have reactions. Well, there are other reasons why immunoglobulin status might be low. Certainly they could be on some immunosuppressive drug. That's a piece of maybe to ask about. But if they're a smoker, they produce less immunoglobulins. If they're over-consuming alcohol, they produce less immunoglobulins. If there's more periodontal disease, they're going to have lower titers. Gender, women tend to have higher, men lower, and some people just have IgG subclass deficiency. So
The periodontal disease, you think because they're fighting a chronic infection all the time, they're burning it up?
yeah, I would imagine the same thing to be true too. Yeah. So again, it just it gives us some. If we see a test that we think that if we don't expect what we're seeing there, then going back to take some history around these issues makes a good amount of sense. Why is your immune system not responding like it should? We know you're reactive. So what's up in terms of these titers? What are you doing or what's happening to your body that's blocking the immune system? And so, to your point, they just probably haven't done the research, but by our Lyme patients, you're not going to see as much of a titer to foods and anybody with a chronic infection. And so again, patient comes in, I always react to peanuts, but it's only mild on this test. What's up with that? Well, remember, we're using raw and we're using organic on our plates. Somebody might, if they're from Georgia eating all boiled peanuts, they might have more of a reaction to that than would be on the plate. And the fact that we're putting people on all these H2 blockers means they don't break up proteins as well. When they don't break up proteins as well, they look more antigenic to our body too. And so when that happens, you end up trading probably not even high acid, right? It was probably low acid in general. When I'm speaking in generalities, why they got put on it in the first place. Now you're not breaking down proteins as well. You're becoming more allergic to them. You try to get off the H2 blocker. You've upregulated parietal cells, so now you're producing more hydrochloric acid than you were before. Oh my God, I burned worse than I did. I really need to be on that medication. And the foods hurt worse than they did because now you've created more of an inflammatory response to those because you're not breaking them down as well, and so the proteins are more antigenic to the system. It's a mess. And it doesn't even, and we haven't even talked about, osteoporosis and mineral deficiencies and all the other things that happen too. And so in these studies where they were looking at more glycated food, they also saw systemically more, my favorite trio, IL-6, IL-8, TNF-alpha. And, I guess it's not rocket science to say that there were more metabolic conditions when there was more glycation, but they were saying it was part of the permeability that was driving this, not just the glycation itself, and of course all those glycated foods destroying our microbiome. Tisk tisk. Here's what I I think jumped up and down effusively about yesterday. But they looked at Candida albicans, and what they found was that there was a similar sequence there on the hyphal wall of amino acids with gliadin. And so you have this cross-reactivity that we should be aware of. If someone's gluten sensitive, they're going to have more of an immune response to the yeast as well. And so, not a bad journal, The Lancet. How did it bypass us all? The Lancet was talking about this back in 2003. I feel like this should be like something I should have been talking about for years. But anyway, there it is. So
was it a human study or just was it?
I need to get the full text still. Yeah. So, but I'll definitely share it. And then there is this issue too. Your immunoglobulins are not necessarily perfect. So when they say, I never ate this food, how can I be reactive? They could be in the same food family, and they'll have that on the rotation diet, but you get polymorphisms in your immunoglobulins too, so it's possible they would have an immunoglobulin that's broken and is now recognizing foods that they don't even eat because the structure is off. So there are reasons these things could occur besides just the test must be bad. So the end product, when all these things happen, more histamine, more serotonin, so people feel racy when they eat foods like serotonin sickness. All those things could be related to what's happening in terms of food intake. Tumor necrosis factor, arachidonic acid, more basophils that are going to produce more histamine too. So I talked about this a little bit. I'm going to try to figure out more about decapeptide from durum gram, because this was one of those things that breaks up the gliadin, and probiotics that create these prolinodopeptidase that was able to safety for patients with celiac disease of baked goods made of wheat flour, hydrolyzed during food processing, and clinical gastroenterology and hepatology, there we go, back in 2011. And so one of the ones that they talked about was Bifidobacterium lactis, which is in our ProBio Plus, not Max. And so, fascinating, right? So we're going to look at doses and see if we can replicate what was done here, but giving gluten, I'm not saying we give gluten to celiac patients, but if we had a probiotic that could chew up gliadin, that's a good thing. And also, again, like I said yesterday, back on the yeast front too. So just some other things like, well, I don't eat much beef. Why is my beef allergy really high? Well, start asking, do they have migratory joint pain, migratory pain, and what are we thinking with migratory pains? Yeah, Lyme disease. So there's a cross-reactivity there. Arachidonic, like the spiders, arachnids, right? So there's a cross-reactivity between arachidonic acid and people who have been bit by ticks. They'll have more beef allergies. And again, when people are trying to be convinced about brain function and gluten, there's a cross-reactivity between gluten and Purkinje fiber. So yeah, if you want to destroy more of your brain, then go ahead and consume that gluten that you're sensitive to. And these are just interesting to me as well. You might have them memorized, but I don't as much. So, they say like, I hate plums, I never eat them. Why am I coming back sensitive? Could be a reactivity with some of their environmental allergies, like birch pollen or mugwort, celery apple peanut, ragweed, come off your melons, and then also chamomile tea is in the ragweed family.
Also mustard greens can cause a ragweed.
Okay, so Cass says mustard greens too with the ragweed. And so it's just kind of, if they're sensitive to latex, then expect to see some of these guys as well. So I don't know where our price point will be yet, but this is we call it ProFood 104. And so it's a new formulation that has a lot more and maybe kind of slightly sexier fiber in there. There's chitin glucan fiber, and let's see how much fiber's in there. So 7 grams of fiber, a nice dose of that. But the reason I mention this is because it is a pea protein, 98% pea. It's got a multivitamin in there. It has 15 grams of protein. It only has 5 grams of sugar, 7 grams of fiber, and our price point is around $12. So even if we put it at 18, even if we doubled it, 25, that's still very competitive. Well, what would you get at Whole Foods? What do you think? What's the general market at Whole Foods for protein powder?
Yeah, probably in the ballpark.
20 to 30. So my thought was to price this right at around something that somebody would get at Whole Foods, because why wouldn't we use a less allergenic, something with this aminogen in there? It's an it helps to facilitate the absorption of the amino acids. It's an enzyme that's in there with our good 5-methyl tetrahydrofolate in there. And, you know, why not give a cleaner, higher nutrient, more fiber product, and rather than running your errands to Whole Food, run your errands here, so you remember about the lecture series that you should be going to in the patient education, and that you should have scheduled your appointment. And Dr. Goley's always said, the people that come are the people that get better. That makes some good obvious sense, but anything that we can kind of use to get them back in the door, I think is smart. So I
When
think
will we have that?
we could get it now. I mean, it's just, I mean, here's my thought. Do I think our other shakes are better? Absolutely, because they're like 5 products versus 1. But do I think that if this could become the new American toast for breakfast, that we would do a whole world of good in terms of nutrition? Absolutely. And so if people can get in the habit of, I'm not eating toast with butter for breakfast, but I'm eating 1 scoop of my shake, 2 scoops of my shake. I mean, that nutritional difference in and of itself, you can't heal the gut without good protein. You can't drive mitochondria without good protein. You can't develop good muscle mass without good protein. And so if we could, you know, if it becomes a lifestyle change instead of toast, then that, you know, who knows? I should try to figure out how many carbs that would bring the diet down, and what that might shift the blood sugar, and how much that might shift the trend towards metabolic syndrome, but I'm not that creative or clever at the moment.
Sure, what's your amino again? I know it's a proprietary trademark. Is that
Oh,
just
it's
the name?
pea. It's 98% pea protein and 2% rice protein. And there's some assimilation story
This
with
is
that
Xanadu?
too. It is, but it's just a much cheaper one that's been available before. This is the glutalamine. We use it a lot, more of a demulcent. So Dr. Burdette had some nice case studies where he had people just doing aloe vera and seeing some. Tell that story again.
It was just a patient with esophageal cancer.
Yeah.
They actually ground up.
Oh yeah,
powder,
the esophageal, yeah.
And it healed it basically.
Yeah, I can't ever say enough about deglycerized licorice as a demulcent, something that coats and keeps people from hurting. And the arabinogalactans from larch tree also increase secretory IgA and decrease ammonia from bacteria as well. 3 grams of glutamine in there, so I would double up to get to that 5 to 10.
That's what's in the previous, what you were talking about, the new.
Oh, that is glutalamine. That's a different product. Sorry. Sorry. No. Yeah.
I just knew it, so I didn't.
Yeah, thank you. This is Probiomax. I mentioned this one yesterday because I couldn't wait to get to the end to say it. But anyway, I'm going to say it one more time because it was so meaningful to me. A public health call to action in Turkey saying that we need to be doing a stool culture on every kid 0 to 3, because if we can track Bifidobacter longum, we can radically reduce allergies, and they didn't track it far enough to say things like autoimmune conditions, but child infections and death. And so, you know, I guess on one hand we think about the immune system in terms of vaccination. I dream of the day when we think of the immune system in terms of a stool culture on every 0 to 3-year-old that comes onto this planet. How the microbiome might be more important. And so you guys, we went over this a little bit when John was here too, but also I just wanted to mention what some of those immunoglobulins, like the Gut Immune Max. I wonder if I've got any data on this yet. But anyway, so I'll check and see if I've got any data in terms of what it's doing to our titers on food sensitivities. But there's, of course, immune support from the immunoglobulins, but there's some other compounds in there that were not in the previous formulation. So sialic acid has some research in terms of reducing cancer, and the oligosaccharides in there are a good prebiotic for your flora. So when you're looking for that piece in terms of dosing the probiotic, lactoferrin will also kill dysbiotic flora. So that's another benefit that we're getting from using. And then, like I mentioned yesterday, some of the TGF-beta helping to improve immune tolerance of the food as well. The dose is less, so people have to do less powder. So if you're dosing the Gut Immune Max, instead of being a therapeutic range of 2,500 milligrams to 5,000 milligrams, now 1,000 milligrams, people like less powder, people like less stuff. So that's nice. Here's some, this was from a piece of research in 2013, and it was talking about other compounds that milk-derived proteins in clinical trials and where they'd seen benefit from them. And so when they were looking at them, they saw not the we're not talking immunoglobulins now, unless it specifically says that. We're talking about the other things they find in there. So they saw health-promoting effects from other peptides in infant and adult formulas to treat cancer. The lactoperoxidase that's in there helps with dry mouth and can even be used as a saliva substitute. Some casein derivatives that are in the immunoglobulins also for dry mouth syndrome. I wonder if you could swish and swallow with that. I haven't tried it in a patient yet. It'd be interesting to see some of those casein derivatives. So we think of it as always bad, but there's some research that talks about certain casein derivatives for hypertension and type 2 diabetes, the lysozyme that's in there, improving health, decreasing incidence of hepatitis, blood transfusion, hopefully just checking for hepatitis with your blood transfusion. The best thing there, lysozyme's an antimicrobial agent, so again, a nice synergy between the immunoglobulins, probiotics, and antibiotics if somebody had to do that. The proline-rich peptides for Alzheimer's disease, here now these immunoglobulins, also helping immune systems and treating broad spectrum, bacteria, virus, protozoa, and that TGF-beta that's in there too, helping to prevent pediatric Crohn's disease. So again, a lot of benefit from other peptides that are there at the immunoglobulin, so a lot of good reason to use those. So just a quick review of some of the things we have out there, except we don't have that one anymore, but we're going to formulate. Did we decide we want to formulate this? Okay, so we'll just formulate it. John's confused. He thinks we want to make this with just Saccharomyces and no immunoglobulins in there. Did we change our mind? You know, he just didn't listen well. Okay. So here's the probiotic plus. This is the Bifidobacter lactis with all those other lactobacillus in there that do these nice things for us. Our Candida Care, it's a great product. It has oregano in there. It has caprylic acid in there. No grapeseed extract in that one, right? What else is in there that I'm forgetting? 2 other things. Maybe. Oh shoot, I thought it was going to be a label on the next slide. And then our Prozyme, don't forget, this has the hydrochloric acid as well as the pancreatic enzymes in there. So if you're looking for one that has both, that's the one you want to go to.